Dana Denha, and you're watching FYI. The city's compost program is always expanding, and this season you can take advantage of the program and create nutrient-rich soil out of your household's food waste all year. Ann Arbor has created a pilot program where residents can compost in the city-provided carts throughout the winter.
They're going to occur on people's regular pickup days the week of February 7th and the week of March 7th.
Composting in the cold comes with its own set of challenges.
With winter compost, we're primarily dealing with food waste. So that means your various food scraps, if you can squeeze the liquid out of them, or make sure to let the liquid drain before putting them in the cart. So if everybody in Ann Arbor were to start being able to take advantage of the composting program, not only would you remove one of the sources of methane, but you would be creating a usable product, because all that food waste goes into our compost program, which gets turned into material that people can use in their yards for their gardens and their plants in their yards.
For more, visit a2gov.org/wintercompost. Stay tuned, and we'll be back with more in exactly 30 seconds. Washtenaw County Parks and Rec make enjoying your area parks a fun, interactive experience. Whether it's sunny or snowy, the parks are always ready to be explored. Rolling Hills County Park is home to some majestic nature areas, but there's also an elusive creature that has inhabited the local wildlife.
Eddie the Yeti, he's a little rambunctious. He likes to get out and cause a little trouble around the park. He loves to do activities in the snow or in the summertime. He likes to ski, snowboard, climb trees, and lots of other activities he can do here at Rolling Hills County Park. Eddie and his family have been living out here for years, and we thought we'd let people know, give them the opportunity to come out and see if they can find him.
Catching a glimpse of Eddie is no simple task.
Today we came out to do the scavenger hunt, the Hunt for the Yeti. It's an outdoor scavenger hunt, and they have prizes inside and hot chocolate and cookies and clues hidden all around the park.
You start out with a map that will show you where to go around the trails. We have clues lining the trail so you don't get lost, and then you have to hike throughout the park to the different locations to find Eddie the Yeti and his family.
Even though it's a little bit cold, it's still nice to be outside. It gives the kids a fun activity to do. It keeps them engaged, and it's really nice to enjoy the parks here.
Hey, careful, please.
Hunt for the Yeti on Saturday, February 5th. Pre-register at parksonline.ewashtenaw.org. It's the snowy season, and there's some need-to-know information for residents and businesses alike as they keep their sidewalks safe for pedestrians. Learn more about snow removal guidelines in this month's City Roundup in 60.
Hello, my name is Robert Keller with the City of Ann Arbor. Winter means snow and ice, and that makes it hard for people to get around the city, especially pedestrians. So as a resident and business, you need to do your part and help clear your sidewalks of ice and snow. What does that mean? Well, for residents, it means any snow accumulation greater than 1 inch has to be cleared within 24 hours. If you're a business, any snow accumulation by 6 a.m. needs to be cleared by noon the same day. So help do your part, clear your adjacent sidewalks, crosswalk ramps, and any concrete bus stops that may be adjacent to your property, and help make it easier for people to get around the great city of Ann Arbor.
There's always been a stigma associated with mental health, but now it's time to break the silence and seek treatment so many of us so desperately need. County residents spoke up and voted to create a millage dedicated to the mental health of our community. And that's when the CARES Team was formed. Joining me is Melisa Tasker, Program Administrator for the Washtenaw County CARES Team. Welcome to the show, Melisa.
Thanks for having me.
I'd like to know a little bit more about the CARES team. This is all pretty new. So if you could give us like an overview of what it is, because I think it's something that everyone should really know about.
First of all, so you can access our CARES team and any of our services at our 24-hour, 7-day-week line. So our 734-544-3050 line. And our CARES team is designed to give people mental health treatment as quickly as possible. It was designed to kind of fill a gap that was occurring in our community where people were waiting months and months and months to find a mental health provider that could see them. And in that time, they would find themselves in a mental health crisis. They'd be going to the ER and they'd be hospitalized. And just like a medical condition, if you don't treat a medical condition, it's going to get worse and you might end up in the ER. And the same is true for a mental health or mental illness. And so our team was really formed to be able to provide some stabilization services that include case management, psychiatry, peer support, to stabilize folks while they're maybe waiting to move on to a longer term provider. Or sometimes we get folks who maybe have had their first severe episode of a mental illness, but don't necessarily need a high level of care chronically. Maybe they just need help stabilizing after that one episode. And then we can refer them off to maybe back to their primary care doctor or lower level of care.
The county has always had mental health services available, but it used to only be for like a small sector of the community. Can you talk about, because that sector
Sure.
is still being serviced too?
Yes. So community mental health is essentially the safety net mental health provider for the community for anyone who has Medicaid. And historically, they've only been able to serve Medicaid. So a lot of folks who need mental health care but don't have Medicaid have been really struggling to access care in the community through their insurance at our local providers. And so the millage was able to allow us to open this new program to serve anyone, regardless of their insurance type or severity level. So CMH has also been saved for those folks who really have chronically severe mental health symptoms and have been unable to be successful in a less intensive program in the community. So this has really allowed folks to, us to serve them regardless of the severity level or their insurance type.
You talk a lot about insurance and stuff, and I think I obviously have health insurance, but I think that a lot of times when you do have insurance, the mental health aspect is not covered very much, even if you have like decent insurance. And so why programs like this are really important for people, because, I talked about that stigma of mental health, but we all suffer at times in our life.
Yes. Yeah. And so, a lot of our private insured, like commercial insurance does cover mental illness. The difference, though, is that most providers don't provide that home-based intensive service that CMH is known for. That we provide outreach services to the community, case management, that, we are, going to people's homes, driving people to their appointments, really doing that extra layer of support that folks who are really going through a mental health crisis often need. Those types of services are not available to individuals who are receiving care in the community. And so that's really the difference. So if someone is privately insured, but they have a severe mental illness, the services that have historically been available to them just haven't been enough.
I mean, what an appropriate name, right? CARES. Because when you think about it, what you just said is like the definition of caring for somebody. And a lot of times these people probably feel very alone, even if they have a family, because where they're at with their struggle. So I'm sure just having your team, take that extra step. I mean, one of the things I read was even about how you follow up with people just to see that they're okay, after they've sort of had that breakdown and maybe they are on the mend, but you're checking in to make sure.
Yeah. And, another thing with the millage is that we were able to expand our mobile crisis team. So in addition to our CARES team, which is really a treatment team where you get assigned a worker and a psychiatrist and a nurse, and you're followed for a period of time, we have our mobile crisis team that is able to respond to anyone having a mental health crisis. So we outreach in the community. We also take phone calls. We provide education and support for people who call us who are in a mental health crisis. And then we are following those individuals up for days afterward to make sure that they're connected to care. And one of the reasons why we developed CARES is because our crisis team would often see people who were in a crisis who had private insurance, and we'd be trying to link them to care and would be unsuccessful. So we'd be following people sometimes for months, only for them to go back into a mental health crisis because we weren't able to connect them to what they needed. And so the CARES team has been able to be that off-ramp source for us. So the crisis team often sees someone in crisis and says, hey, they really need to see a psychiatrist. They really need this. And we're able to get them in really quickly. So it's been a really nice, a really great resource to have both of those programs working together.
I think when you are in a mental health crisis, it's hard because I think that your mind can play tricks on you to think that maybe that there isn't help, or like you shouldn't call or something. Do you find that there's like certain things that happen in people's lives that would maybe be a trigger, or you could even tell us like, maybe this is happening to people and this is your trigger, but you don't realize it because your own roadblock is your own brain?
Yeah, I think a lot of people, I think we're all raised to feel like we are supposed to be able to handle things on our own. And I think with a mental illness, which is hard to see on the outside, I think a lot of us, if we're struggling, we tell ourselves that we should just be able to fix this ourselves. And it's really hard, I think, to recognize that, maybe this is beyond what I can do. And so I would say, if anyone's feeling like, that you're unable to do things that maybe you could before. So big red flags for us when we're always asking or we're assessing is, are you able to go to work like that you used to? Are you able to maintain the relationships that you used to have? Are you able to keep up with the routine that you used to do? Are things that used to give you joy still doing that for you? And if you answer no to any of those questions, it may be time to ask for help, because if you're seeing any disruption in your daily life, that is an indication that there's something going on. I think that we all experience some sort of mental health symptoms ongoing. Like we may have periods where we're anxious or feeling down, but the difference is how it affects our ability to actually move through our day. And so that's really an indication of, when it's time to ask for more help, or, when to just keep an eye on things.
So how does it work? You can call, can you email, or is it, are there different ways to get in contact with the CARES team?
Sure. So right now it's a phone call. And I know it's hard because I think a lot of us have a hard time recognizing when we do need help. But we have clinicians that are staffed 24 hours a day. So if you call that 3059 and you tell them that you just need help, we're going to ask you a bunch of questions about how you're doing and about what's going on to maybe get an idea of the level of your need. So are your needs such that you need the crisis team to come and see you, which we totally will, or are you looking for an outpatient appointment? We have people call and they just want information about how to access the system, or maybe you just want information about mental illness in general and what to do and what things look like. We can offer all of that to you, but it is a phone call and you can get someone on the phone 24 hours a day.
So like you said, if it's a crisis and you'll go to people's houses, whatever it might be. So then if people need long-term care, connecting them with a psychiatrist or a psychologist?
Yes, we follow people until they're able to get connected somewhere and they're feeling comfortable. One of the things that our crisis team has is we have this big crisis board, and everyone that we have contact with goes on the board, and we are calling them every day, sometimes twice a day, or we're outreaching them every day just to check and make sure that they're okay, and really walking through the safety plan that we came up with, and really making sure that they're doing okay.
Well, it's interesting that you mentioned before about like these 6-month wait times, because I am a part of this Ann Arbor area moms Facebook group, and someone recently just posted about how their child needed mental health services and they could not find a doctor for 6 months. And I had no idea that this was like going on even at the time. And is it COVID related, or is it just hard to find a doctor in the area?
It's, you know what, it's just hard. I think COVID has made things worse. I think unfortunately there are, we've seen a shortage in providers, and we've seen more people looking for services. But historically, there has just always been a really long wait to get mental health treatment. Unfortunately, we don't have enough psychiatrists across the board, across our community to go around, especially not youth-specific psychiatry. And so it can be really difficult to find care in a timely manner when you need it, which is so important, right? Because just like treating any other medical condition, if you don't get care when you need it, it's just going to get worse. And that's one thing that it's important for people to understand, is that mental illness, really just gets worse as it goes on without being treated. It doesn't kind of just go away. It just really requires you to get an intervention.
When you go on the website, you have press releases and stuff about the program. And one of them specifically talks about how the numbers in hospitals is lower because of the CARES team. Can you talk about that and how you're making that difference in the community? Because that has to feel good.
Yeah, so it's really exciting. I think when we first started, that was our goal, right? Because we don't want people to get to a point where they need to go to the hospital, because that means that they weren't able to get care before then. And so the fact that we're able to treat people when they need it, when they're identifying like, hey, I'm not doing well, and we can provide an intervention, so maybe less people are needing to seek out emergency services. That's been our goal the whole time. So I think that because the data is showing that it is working is really, really exciting. And our CARES team, our professionals that work on the team are just so amazing, and they're doing such a great job, and they work so hard. So all of our mental health professionals, we have a whole team of peer support specialists too, who are they just do amazing work. They really connect to people in the community. They meet people where they're at, because it is really difficult to access care and recognize when you need help sometimes.
So when was this millage passed, and how long is it for? Are we going to have to vote on it again in a few? I mean, because I think it's important that people know about the CARES team if we're going to have to, vote on a millage again for it, so people know how beneficial it is.
Right. So it is an 8-year millage. I believe it passed in 2018, and our services became operational in 2019. So the CARES team has been operational for over 2 years now, which is why we've been able to pull some data out of there. So in about 5 more years, we're going to have to, the community will be asked to vote on renewing the millage.
Like I said, that's why it's so important to talk about this now, because it is a new program. And I think, like I said, for instance, that Facebook post I talked about, that the CARES team could have been beneficial in that scenario. And I didn't even know about the CARES team when I read about it.
Yeah.
So it's really
absolutely.
important to talk about this stuff. Yeah.
Yeah.
So before we go, why should people, just have this in their arsenal? I'm not saying they should call, but, maybe if they do feel the need, you never know when something will happen, something that just triggers something that's just really dark, and you need help, and you just need help, and you want to talk to somebody. And I'm sure in some ways, and I'll add this onto the question, that it's easier to talk to someone that you don't know.
Yeah. I think, especially with mental illness, I think especially for youth, it's hard to talk about some things that are scary. I think having mental health symptoms can sometimes be really scary. And so having a reaction from, people that you care about can sometimes be even more difficult. So, we are here to just talk through anything that is going on with you. We've heard it all. Nothing is going to surprise us. We are here to support you and guide you. We're also here to support family members. We do have family members call, and friends all the time. And that's so helpful, because we can provide you with information that you need to know. Is it the right time to do this? What do we think that, is needed? How can you help? What does this mean? So that you can guide your loved one if maybe they're not ready to call. We can always receive information. We can't necessarily give out information, obviously, but we can always take information and answer general questions from anyone.
All right. Well, thank you so much for coming on the show and filling us in on the CARES team.
You're welcome. Thank you so much for having me.
For more on this and other programs, visit a2gov.org/CTN. Visit youtube.com/CTN Ann Arbor to see all that we have to offer. Remember to like, subscribe, and ring that notification. Thanks for watching, and tune in next time to FYI.